Having worked among the community on so many issues, I've heard a range of different matters that are important to people, and I want to be able to make a difference as a Member of Parliament in so many ways. Access to mental health is one of the big ones, especially among young people. This was highlighted for me when, over the last 6 months, a number of young people in the Goldfields sadly lost their lives to suicide. On the 11th of January 2021, a friend of mine in Kalgoorlie, Sharron Duffy, lost her 19-year-old son, Bryces Duffy, to suicide. It is with Sharon's permission that I recount her story. For over a decade, Sharron Duffy sat powerless, helpless and scared as she watched her son continue to take his own life, when the system that was supposed to support him continued to let him down. Since the age of 10, Bryce had had many attempts at taking his own life, but due to his young age and issue with drugs, there were limited options of support available. On 3 occasions after a suicide attempt, Sharon rushed Bryce to hospital, but faced the same issues each time. She was told there were no mental health beds at the hospital for youth under the age of 18, which meant that Bryce could be kept in emergency overnight but could not be admitted and was sent home the next day. In Sharon's words, there were so many times that I could tell he was suicidal or had self-harmed, where I considered taking him to hospital. But it was too hard to get him there, and what was the point? I knew they would just send him home, she said. I spent so long, so many years not being able to do anything. As a mother, you're supposed to be able to care for your child, protect them, and when you're powerless to do that, it is really upsetting. It was really hard, lots of sleepless nights and crying, stressing, terrified that my child was going to kill himself, and now it's too late. It's too late for my boy, but I don't want it to be too late for anyone else. Sharon used her voice during this tragic time to call for stories from other parents. 20 submissions from the Kalgoorlie community outlined that the problems that Sharon's family faced were unfortunately all too common. These submissions detail the personal experience families have endured trying to get their family members, often children and youth, help from services. Multiple gaps were identified, and as a parent and grandparent, this broke my heart. No parent should have to go through this. One of the first things I did once elected was bring Sharon together with key health professionals, and the challenges and hurdles faced by parents was discussed in detail. As you said, Sharon, suicide is a permanent solution to a temporary problem. We need to support people in their times of need and ensure the system supports them and makes them well again. If we do not do this, then more people will suicide and more families and communities would be left grieving the loss of those they love. Thank you, Sharon, for your strength, your ability to share and bring others along with you. Statistics from the Australian Institute of Welfare and Health show that in 2019, suicide accounted for 1.9% of all deaths in Australia. That's shocking. And for Aboriginal Australians, it's even higher, a devastating 5.9% of the population. As a government and a community, may I seek an extension?
Extension granted.
As a government and a community, we must address this. We must do better, and we can do better. I will be working with Sharon to push very hard for the changes that we so desperately need. Thankfully, I am now part of a government that understands how important it is to significantly fund mental health initiatives. A $360 million package will be funded to address critical gaps in the mental health system, and importantly, this will include more than $122 million in the expansion of mental health services to young people. This privileged position I find myself in will never be taken for granted, I promise. I was lucky enough to count on the Premier Mark McGowan, who visited Kalgoorlie on so many times during the campaign. It enabled me to discuss many issues that are important in my electorate. And if you haven't walked down the Hannon Street with the Premier, you really haven't lived. What an experience.